This is Howard Mann, and this segment of our discussion on value-based purchasing and value analysis is our third part. We're going to talk about some potential processes of combining both value-based purchasing and value analysis. We call it finding the middle ground. Value-based purchasing, as a reminder, is where CMS reimburses the hospital based on the DRG plus or minus an assessment amount for 3 days prior to and 30 days post-admission for all services, including clinical, physician, and rehab if needed. Value analysis, on the other hand, is a systematic and critical assessment by a committee of clinical, service, or equipment acquisitions with a focus on making the best value decisions on those products and services. The question is how do we meet the requirements of both processes? One way to look at this is through CQO. On CQO, we are looking at fusing the structure of expanded analysis with the patient at the center of and the result of efficient, continuously improving processes at the appropriate cost. So, how do we do that? One possible way is expanding the value analysis process to include broader literature searches at the beginning of each review, requesting and pulling data on clinical outcomes, engaging a broader spectrum of stakeholders in the process, including physicians, clinicians, finance, revenue cycle people, health information management and coding. So there are several steps in trying to achieve this that we would want you to consider. One would be the data gathering step. In data gathering, we need to begin with collecting data, both financial, clinical quality, patient satisfaction, benchmarks, and reimbursement. I would suggest that we would use internal resources initially, but then extend out to external resources for benchmarking. When looking at capital equipment, there's some excellent benchmarking tools out there that many people are familiar with in materials management. Another portion of step one I would suggest is assessing technology data on supplier innovations in the area under investigation and summarizing and referencing all your research data into a presentable format. The next step is assembling the team and setting the structure. You need to define your audience. You need to include those stakeholders, and you need to think about your audience in total. Setting a primary or secondary strategy is always more effective than having a single strategy. And setting your goals and timelines with that team in mind. So it's very, very similar to project management. You need to make sure your presentation matches that audience and answers all aspects of CQO. The third step is to actually conduct the meeting. You need to meet with your stakeholders, present your data, clearly state the goals you had in mind when you began, and share your strategies. You need to take time to listen to the audience's ideas and concerns and either address, put them in a parking lot until you can gather more data, or subsequently schedule for another meeting time to finalize responding to those kinds of ideas or concerns. You need to seek consensus after issues and concerns are addressed, and agree on the format and time to share the adopted strategy with your suppliers. Step 4 is actually including your suppliers throughout the process. You need to meet with the suppliers, talk about their data, clearly state your goals, and share the consensus strategy once it's decided upon. You need to include the members of the audience that wish to participate with the supplier, and take time to listen to suppliers' ideas, concerns, and issues. I would also suggest you set timelines for responding to those ideas, concerns, and issues, and set timelines for decisions. And then set acceptable and unacceptable supplier behaviors as part of the discussion. The final step would be to complete the process. You need to announce your final decision, recheck and determine if the CQO factors are being met, decide on how to measure the success or failure of the process, and implement it. And then apply the process to supplies, services, capital, and any other area of spend within your organization. And finally, communicate, communicate, and communicate. You need to communicate with all stakeholders. You need to communicate with your organization, your executive leadership, but also the people that are involved in the decision process. Hopefully you can share this information with your value analysis committee and hopefully begin building your new value-based purchasing and value analysis process. Thank you.